Hi, my name is Sudian Lewis Dawkins, and one of the topic I want to touch on is how to find a good provider. Whether that person is a doctor, a nurse practitioner, or a physician assistant, or whether you're looking for a primary care provider or a specialist. Yes, it's important that you look at their years of experience, what certification they hold, or what school they went to. But the most important thing I believe you need to look for is that person's communication style and their approach. Way too many times we hear our family members and friends coming back from their doctor and we ask, hey, what did they tell you? I don't know. Or they may say they spoke for like 5 seconds. I wasn't able to talk. I don't know what's going on. So I have four things that you could look for when looking for a provider. So the first thing that you want to look for is someone who listens carefully, listens to everything that you have to say, do not cut you off. The second thing that you want to look for is someone who is able to explain everything clearly to you. So I heard once you're not a good communicator or a good teacher if you're not able to explain something super complex to a 6 year old and that 6 year old understands what you're saying. So you want someone who's able to break down all these big medical terms to you and you're able to understand what's going on with you because it's your body. Now, the third thing that you want to look for is a provider who respects your preferences. You're the one that lives your day to day life. You know what is possible for you to do and what is not. You don't want to have a provider that gives you a very complicated medical plan that you cannot stick to. With your life, you cannot stick to it. So you want someone who hears you out and respect your preferences when you tell them and they tailor your medical plan to your needs. Now, the fourth thing that you want to look for is someone who encourage shared decision making. So at that visit, you want someone to ask you any concerns, anything to add. Do you have any input? Let's work on this together. This is your health. Let me hear you out. Let me hear what you're thinking. You want someone that's open like that. It should be a collaboration between you and that provider because, again, it's your health, it's your body, and you should take control of it. Now, you could generally feel out a provider on the initial visit. You could basically tell what kind of communicator they are with that visit. So the next time you have a televisit or in-person visit, use these four strategies to find out if that provider is a right fit for you long term.